Our next speaker is Dr. Tanya Soldak. Dr. Soldak is the Director of Programs of Resource and Policy Exchange. It's a U.S. nonprofit organization dedicated to equalizing standards of healthcare, information access, and participation in government around the world. Dr. Soldak has been involved in our groups as our Eastern Bloc representative for many years, and she single-handedly is responsible for the translation of the Breast Health Global Initiative guidelines into Russian. She approached the Bloikhin Institute and who provided this very fine work, and I'm so excited to have you here to speak to us about your work. But she is the quintessential advocate, that she drives forward, she never accepts no as an answer, and she solves problems. Please, Dr. Soldak, if you could come up and join me.
Good morning. I want to thank you, Dr. Anderson, for inviting us here, and we are very honored. I will start with my presentation with Advocacy Memorandum. I'm sorry, for some reason. I will start with the advocacy definition. Definition of advocacy, we try to find advocacy best practices. And when it exists a lot of definitions of advocacy, our favorite is at the bottom. Creation or reform of policy, effective implementation and enforcement of policies. And I think it stands for what our organization tried to implement in breast cancer. This is a memorandum, what I want to read on behalf of our dear friends that died from breast cancer. She was a simple woman who basically, before her death, wrote this memorandum to women and advocates. Basically in Eastern Europe, she was originally from Belarus. Irina Kazulina, what women want. No woman wants to be a breast cancer patient. If she is healthy and wants to know how not to become a breast cancer patient, she needs information about breast cancer and its threats, opportunity to have breast exams with a trusted doctor, access to a modern diagnostic methods and information or where they're available. If she has been diagnosed with breast cancer, she needs the right to receive complete and accurate information about her case, to receive her doctor decision on the best most affordable current treatment available, the right to a second doctor opinion, to get the best medicine available from different sources. If she has been diagnosed and received treatment, she needs support of family, friends, and colleagues. Becoming a cancer patient wasn't by choice. Women shouldn't be ashamed of diagnosis, information about methods of rehabilitation following treatment, either medical or alternative, opportunity to meet with other women, breast cancer survivors, for support and information sharing, such as support groups or clubs. And she needs respect her life and value life. The main problem of Eastern European women, not respecting all and loving ourselves, treating ourselves as imperfect, not nice or clever enough. We can't imagine how we can demand anything from authority, from state. So basically it's a lot of words, and with my accent, I hope you can get essence. It was very emotional. She wrote it basically in the 4th stage of her diagnosis and put all her thoughts together, basically send this message to the world. And we circulate this memorandum in our advocacy meeting and group, and I will demonstrate how we do advocacy in Eastern Europe. Eastern Europe, it's by definition, it's not include Central Asia, but we working in Central Asia, and it's basically more Eurasia. Even in WHO European office, they include Central Asia countries. This is countries where we working or with whom we working and have representatives. When you work in a region, you always think about commonalities and basically variation, differences in the country. So all these countries, they have what is the most common. They are post-Soviet socialistic states with a strong government and unstable democracies. And their civic society is not developed. It's passive, and that's why they have a lack of beliefs, and people actually don't believe in individual influence. They have very little research, and I would say like a limited local epidemiological data. They have all universal health care, and they have high literacy rate. Variation, they have different economic status. Some of them are accepted in European Union, and some of them have very low and basically failing state economic status. They're struggling with the health priorities, communicable disease versus non-communicable diseases, and in developing healthcare, they're struggling primary healthcare versus tertiary healthcare. They also have different cultural beliefs, and it depends and varies from the north to the south, and it depends on different ethnicity. In breast healthcare reflects actually their political and economical status, and they have huge disparities in breast cancer mortality and morbidity and survival rate. We have our advocacy objectives for Eastern Europe is basically inclusion of breast cancer in public health policy. Breast cancer in all the states, not included, or if included, it's not proceeded further with implementation. And we focus on changing resources for allocation. Basically, we are advocating for increasing resources for breast cancer care. We also focused on establishing guidelines to address breast cancer screening, and it's not just policy paper, it's just guidelines how to start mammography, like very detailed explanation. And because many states purchase mammography machine, and they think that basically they already accomplished mammography screening. Then we focused on helping them address hormonal receptor status guidelines, advance in the guidelines to address metastatic breast cancer, as the stage of breast cancer detection is mainly on the 3rd and the 4th stage. We're also helping them in development of palliative care guidelines. We facilitate reform to address early breast cancer detection, and it's mainly focused on clinical breast examination and ultrasound.